Hi there, Dr. Smith here, and thank you for joining me. Today I'm going to answer this question, well, at least give you an idea of how I approach this question of why are diet and exercise not working for me. I hear this from clients routinely. I eat a healthy diet, I exercise, I take supplements, and I don't understand why I still have these symptoms. I start getting super curious when I hear these things, and when the story continues on to talk about how maybe you've seen a couple of different naturopathic doctors or functional medicine doctors and had some improvement, but generally still in the same condition that you were before the lab test, before the supplements, before the exercise programs and the diets. I start to get really, really curious. And I have my first question when clients come and tell me that they've been eating a healthy diet, and through questioning them, that's verified, right? So obviously, if you think you're eating a healthy diet, but when we really analyze it, we find out that, well, you might be eating a lot of foods that you're sensitive to or intolerant to. Well, that's another question. But when a client or a prospective client tells me, yeah, I've been eating a really healthy diet, and I exercise with moderate to heavy intensity, 3 days a week, but I'm not seeing any improvements to my symptoms. The first question that I invariably ask is, what do you think the underlying issue is here? Now, the reason that I ask this is because I've found that most people have a really keen insight into what's going on in their own body. And the medical system really is not set up to take these thoughts, opinions, and theories that a patient has very seriously. And even with the alternative medical world, there often is this idea that the doctor knows and the patient's job is merely to relay symptoms. So there's a lot of power in just the novelty of this question, since most people have never been asked by their doctor for their own opinion of what's going on. So it has a great potential to break this assumed power dynamic of the patient-doctor relationship and really empower the client, empower you. The question usually opens up a pretty rich and productive conversation through which a deeper understanding of the underlying causes of a person's illness happen. And it's not uncommon for things like toxic relationships, unfulfilling careers is very common, or past emotional and sexual trauma to surface as having really intimate connections with the current health complaints that this person has been presenting to numerous doctors with. So I find it super heartbreaking that many people have been told that these issues have nothing to do with their health, or that because these elements are part of their health history, that they've been told it's all in your head. And I actually want to address this latter point specifically, it's not in your, it's all in your head idea, by first saying it's not all in your head. Just because you've had a lot of stress in your life, just because you've had a history of traumatic experiences or a mental health diagnosis, does not mean that your physical symptoms are not real. I would consider this one of the greatest and most horrific lies that doctors routinely tell their patients or insinuate to their patients. Maybe doctors don't outright say that it's all in your head, but the insinuation is commonly there, and I know that because that's the experience of a lot of clients I see. So one, if you're having physical symptoms, then the experience is very real for you, regardless of the cause or the origin of those symptoms. Period. If you're having diarrhea, even if a doctor can't figure out what's causing that diarrhea, it doesn't change the fact that you're having diarrhea. If you're having chronic debilitating pain, just because a doctor can't find out what's causing that pain does not mean that that pain is not real for you. So that's the first point. And two, it's an extremely well established, it's extremely well established that there is a connection between our thoughts and our emotions and our physical bodies, that this connection is very real, that our thoughts and our emotions can absolutely dictate or change how our body's physiology is operating. So your thoughts and emotions can affect your digestion. They can affect your pain. They can affect your sleep. They can affect your headache, your energy, things like that. Your blood sugar, your hormonal balance, which means your cycle or your menopause, right? So all of these things are absolutely changeable with your thoughts and your emotions. Two areas of research that look at this connection specifically are psychoneural immunology and psychoneuroendocrinology. So both of these areas of research are looking at how our thoughts and our emotions impact both our brain's physiology. Okay, so our physiology, not psychology, but how our thoughts and emotions, right, our psychology are affecting our brain's physiology. So that's when you get those cool, like colorful brain maps, like on an MRI scan, and how those are affecting our immune system and also our hormonal system or our endocrine system, right? So, I mean, these are hardcore connections between how we think and how we feel about things, our experiences, right? That feely, sensitive aspect of ourselves that everybody has, even if you're a man, and how those things are directly impacting our body's neurochemistry, our body's hormonal system, our body's digestion, our body's pain symptoms, our nervous system, things like that. So, but here's the catch, right? We talked about it's not all in your head, right? You're having these physical symptoms, but here's the catch. A person's symptoms may be very real, but if the underlying cause has to do with a toxic relationship or an emotional or physical trauma or chronic stress, then medications, supplements, diets, exercise are likely not going to be enough. They're going to be an inherent part of living a healthy lifestyle, yes, but the healing is going to happen at the deeper level, the levels where those problems are actually existing. And I know that this can be a scary prospect for some. However, looking around for a practitioner or therapist who is able to facilitate a safe environment for you so that you can start looking at these areas of your life is going to make it a lot easier and less scary for you. In fact, just listening to this video and thinking about how your personal experiences in your life may be affecting your health is actually an incredible first step. Like seriously, just that step of considering maybe this is real for me. Maybe the traumatic experiences that I had as a kid or in my young adult years or last year, that car accident, maybe these things can or are affecting what I'm experiencing right now and why I'm not able to see any improvement with some of the stuff that I've been doing. So consider that because a lot of this work is very slow and very gentle and kind of happens as we start to just internalize these different aspects of what's going on. And there's tons of different avenues to travel down to heal from emotional trauma, to start working with chronic stress or toxic relationships. And it really all depends on kind of where and how you are stuck as an individual. So if you I have all these written down in the blog post that kind of corresponds here. So I'm just going to run through some of the different tools that I utilize in my practice. I love somatic modalities. So individuals who have experienced trauma in their lives usually don't want to relive those traumatic events when they go to therapy and they're trying to heal. So for this reason, psychotherapy has really gone out of favor for those who are working with trauma like myself, because there's just this tendency to relive these traumatic events through the retelling of them. And so instead, we're really starting to move to these somatic modalities such as EMDR or somatic experiencing or body talk. And there are others, but all of them utilize an awareness of body sensations to help facilitate the body's innate ability to regulate and balance traumatic energy that's been trapped inside the nervous system. So these are super wonderful tools. They're very gentle and very powerful. They're very helpful at helping individuals work through the trauma that they've had in their lives without having to tell their story over and over and over again and get, because that can be a huge problem. Another tool that I use is counseling, and I mentor people in their emotional and kind of personal development growth. And because a lot of people just simply need assistance learning about their thinking and their emotions. And I'm going to give you an example of something that's super common that I work with is clients needing help counseling with their negative self-talk. And there's so many of us that can relate to this. I have so many clients who have a self-critic who makes it nearly impossible for them to live peacefully from day to day. And it adds just a tremendous amount of stress on their lives and also makes it very difficult for them to make positive changes in their lives. So, this is an area where counseling, cognitive behavioral therapy can be a wonderful benefit. Other tools like EFT, I do a lot of walking meditations with individuals. There's a lot of tools for helping gain skillfulness in these areas that we work on. So, and then, awareness practices in general are always going to be beneficial for individuals who are, on this type of healing path. And, a quick list of my favorites are, breathing. Mindful breathing is a must. We really owe it to ourselves to be more conscious in how we breathe in a moment-to-moment basis. It helps us maintain and gain a sense of presence, and how presence really changes our relationship with anxiety, with depression, with our thoughts and our emotions. So mindful breathing is an absolute must. And then Qigong, Tai Chi, or any type of martial art is just amazing for connecting ourselves to our bodies and building an awareness of body posture, body positioning. And then also mindful walking, barefoot walking is something that I love. I teach people an exercise called pacing, which is essentially slowing down our mental process and being in the present moment, even when we are rushing chaotically through our day. So it's really like changing our mental perception, even if our physical activity is, needs to be rushed, needs to be hurried. I mean, you're getting the kids off to school, you're getting yourself and your spouse off to work, and that can be a pretty hectic time. But mentally, it doesn't need to be as hectic as sometimes it is. So that's where, an exercise like pacing can be very helpful. And then I like to utilize cold showers as an awareness tool, and also as like a self-love tool. And so I work with clients on that. There's a little little bit more to it, but in a general sense, taking a cold shower and building a relationship with cold allows us to really tune into an awareness of the present moment, because shoot, like, it's uncomfortable to be cold. And so a lot of times, like, our mind will come into the present moment because it can't really think about anything else, which can be a very powerful tool. So that's all for this week's blog. I hope that you enjoyed it and got something out of it. And have a wonderful week. All right.